Assalamu alaikum. For today, we will start with the community health session. So we will talk about elderly. So, what we mean by elderly? More than 60 years. No discount, or you can pay more. Usually they consider elderly after the age of 65. They are raising a little bit to 65. So the objective for this session, so we'll describe the various meaning of aging. Then we will define the gerontology nursing, what we meant by gerontology nursing, and discuss the major health concern of aging population. Then explain the major preventive health issues for elderly people. The last one, which is discussing the special health consideration that the community health nurse should be aware in caring of an adult or elderly. Discuss also the community awareness program in Oman. What are the programs which is related to elderly people? So about the elder health, we have many definitions related to elderly or related to the age. One of them, which is aging. What's the meaning of aging? Aging, it is the sum of all changes that normally occur in a person within the passage of the time. So it is a process since the development until death. The aging process, there are some changes which has happened to our life according to the passage of time. It began with conception and it ends with death. So from conception to death, there is aging process. We start to counting from conception. How many weeks of conception until birth? Then we'll start with months, years, until the death. There is what we call it primary aging. Primary aging, which is the biological process. The biological process whose first cause appropriately to rooted in heredity. So there are, which is the sign of aging, the change of the sign in the person according to his age. It depends upon the heredity. So it is linked with the heredity. Then the primary aging is gradual and it is inevitable. We cannot avoid it. Can we stop the changes in our life, in our body biology and physiology at a certain time? It cannot be stopped. It is going. There are changes which is happened daily by the aging. So we cannot avoid it. So it is an inevitable process of the body deterioration. Start with building, then it will start with deterioration mostly after the age of 40. That takes place through the life. Primary aging is genetic, so it is the primary one. It is genetic according to the genetic process. So in the changes in the person, it is expected according to the changes within the family. It is a pre-programmed coding that occur in the body and follows, the body will follow it according to the genetic process. So it is programmed within our body. There is another thing which is secondary aging. So what's the difference between secondary and primary aging? Primary aging, we said that it is linked with heredity. So according to the family, according to the race, we can expect what's the changes that might happen to the person. But secondary, it is related to which factor mainly? Yes, so it is this. So it is related to disease. So because of that, some changes, we can look at a person, we can see that, we can expect that this person is within 60 years, while he is in 40s. Why? Because he is debilitated by other diseases. So the secondary, it is depict that disability whose first cause come from a hostile factor in the environment, particularly trauma, either due to trauma, due to accident, or due to disease. The secondary aging results from disease, lack of physical activities also, and unhealthy activities like smoking, alcohol drinking, poor nutrition, and exposure to hazard materials, according to the hazard that he is exposed to from either the environment or work environment or the general environment. So this will affect also the aging process. So you can differentiate now between the primary and secondary aging. Yeah. In aging terminology also, age is, when we say age, what's your age? So if I am asking you about your age, I am asking the length of time of a person exists from birth up to this point. So it is counted from birth up to the point that he is in. When I say 19 years, it means that 19 years already passed from his age, from the date of birth. There is a lifespan, which is the minimum potential for survival or particular species. We can say it depends upon the community, depends about the species. When we are about human being, the lifespan, it depends upon here in Oman it is around I think 70. There might be difference between male and female in the lifespan. So life expectancy also, which is the expected life, which is the average observed year of life of a species from birth to death at any stated age. We can expect that, we can say that the expected age in a certain area, it is 60 years or 70 years or 90 years, according to the calculation that they do within the community, according to the statistics. It will be raised or different according to the many factors. If there are too much death among children or among infants, this will decrease the life expectancy according to that. Longevity also is the expected length of an individual life based on the life of their immediate family members. So this is within the family member. That expectation, it is usually within a country. according to statistics. Here, according to the family. So, according to the family, we can say that this family, they are live too longer than other families. This family, they are having a short span of life. So this is what we call it lingo activity. The older person and elderly, they are considered the person as elderly if he is at the age of 65 years or more. Because of that, most of the country now, they are raising the retirement age to 65. Because they didn't want to pay for them for a long period of time. Just after retirement, he will take maybe for 2 or 3 years. After that, he will go to death, and they will not expense more on that. So this is the most issue that they want to do. Here, up till now, the working is either 20 years or 30 years. Geriatric, if we are saying the term geriatric, it is the branch of health science which is concerned with the disease and the problems of old age. So geriatric and gerontology, it is the term related to the diseases that affect old age, which means that more than 65. Different health problems also is mentioned in your book. You can refer to page 30, table 35, 3, in page 868. There are many expected diseases that might happen to the old age. Who can give me some of the health problems that affect old people? Hypertension, heart disease, diabetes, arthritis, renal failure. So there are many diseases that might affect the elder people. Prostatic enlargement and prostatitis. There are many diseases that might affect it. So osteoporosis in both, but most common on female after the age of menopause. It starts earlier. Hyperlipidemia also, increased level of lipid, which also linked with other disease, with hypertension, with also diabetes mellitus, hypertension, pneumonia, depression by old age, visual impairment, hearing impairment. So all the systems start to come down in their function. So here, preventive studies for old and adult. In old adult, for osteoporosis, which is the bone densitometry, they have to do bone densitometry in order to see if there is osteoporosis or not. For women, at least once after the age of 64, but it is better also to be done before, because by menopause they are starting to have osteoporosis. Menopause started in some ladies at 45, and in some it might be late. For men, at least after 75. Hyperlipidemia, lipid profile, it has to be done every 5 years as or more often in case of cardiac diseases, in case of diabetes mellitus, peripheral arterial disease, and biliary stop. Here for lipid profile, and those who are after 40, they are doing it at least once. After 60, every year they are doing them. For those who are having diabetes mellitus, annually they are doing checkup for them. They are doing that lab study for most of the tests: renal function, the renal function, lipid profile, and blood sugar, and also the accumulative blood sugar. So it is done annually at least. Also checking of vision, hypertension, blood pressure, it has to be done yearly. Influenza immunization, after the age of 65, it has to be given annually. Pneumonia vaccine also once at age of 65. Obesity or high weight should be observed yearly, and to see also the body mass index. Lung cancer, especially smoker cessation, we have to prevent it by smoking, and every office visit it has to be checked. Secondary prevention, alcohol abuse screening, depression, we have to do screening of depression for old age also. Hypothyroidism, if there is any complaint from the patient, we have to check it, especially every 1 to 2 years after the age of 65. Colon and rectal cancer also after the age of 40 or 50, we have to do at least PR once or every year or every 2 years. Hearing impairment, we have to do screening for that every 1 or 2 years. Breast cancer, mammogram, they are doing it after the age of 40 here, and every 3 years they are dealing with it. Skin cancer, skin examination yearly also. Visual impairment screening, it has to be done yearly for old age. Anyway, when we are getting old, this is the fact that everything will hurt. If it doesn't hurt, it means that it is not functioning. So by the age, especially, if you are sitting, you will feel the pain. Sometimes you have to change your position. So if you are doing anything, it depends upon the activity also. Those who are more active, they will be able to have a good health for a longer period of time. Their complaint will be less. Their tolerance will be more. But if the level of activity is low, mostly we are complaining whatever we are doing. If we are lying down, if we are standing, if we are walking, always there is some complaint. Or if there is no complaint from, as they said, that it might be non-function. So different assessment for aging population, it has to be done. So functional assessment, which is the ability of the person to do the daily activities of living. So we have to see at least what he is able to do, what thing that he is in need for some help to do it, what's the thing that he is unable to do it, and is there any possibility to enhance his ability to do the activities of living or not, and what kind of help that we can help them with to overcome those problems. So this is one of the assessment that we have to do. So we'll see, is he able to eat well, if he is able to communicate, if he is able to also the ability to pass stool, pass urine, what's the problem with that, what we can do, what we can help, how we can return it to normal if it is possible, or help him to be at least near to normal. Physical assessment, in the physical assessment, the vision, hearing, all the senses, we have to assess him, and if he is in need for an aid to help him to hear well or to see well, like eyeglasses or earpieces for helping him in hearing. So all of those things we have to see it and to assess it. Mental assessment also, we have to check the memory and mood of the person. Instrument can be used as checklist assessment for them. Orientation of recall, language and attention also, ability to attention for that person. So all of that has to be assessed for the geriatric person. Socio-environmental assessment also, we have to identify the family living situation to see. So we have to identify the family living environment for that person. Is there a caregiver who can help those geriatric person or old person? Or is he able to serve himself by himself? What kind of help that is needed for them? Do they need some social support or financial support for that? So there are some associations that might help. And you know that here there is association لإحسان, جمعية إحسان. They are dealing and helping the old age. They are providing sometimes wheelchair for them, walker, bed. So they might need also some expense. You know that they are not working. They need some expenses. It might be more, like especially if they are debilitated and if they are bedridden, if they need diapers to be changed, and you know that it is costly for the family, especially if the family is having low income. So they might need also financial support. It can, here also they are supporting them financially by the social welfare. Specify the preventive health care for elderly. One for elderly, we have sometimes it might there is a normal change within the vision that changes their far sightness. So they will not be able to see what is near, but they can see the thing which is away. Also, sometimes they are having both. They cannot. The sight will be less even for far and for near. Because of that, the changes which has happened mostly for most people, they will not be able to read properly, especially those small letters. Also, cataract it might be there. Do you know what's the meaning of cataract? What is it? نزول. What's نزول? Huh? What will happen to the lens? What's the changes on the lens? Yes, so it is called opacity of the lens. So the lens, it is a transparent, isn't it? So when it is transparent, the light, it will go inside and it will go to the retina, so we can see. When it has become obese, it means that it is like a screen. So the light, it cannot go inside. So they need surgical removal or surgical replacement of that lens in order to see well. Eye problem need to an annual assessment and can be corrected by, for the cataract, it cannot be corrected by the eyeglasses. Can it be corrected by the glasses? No, it cannot. So it has to be corrected surgically. For other problems, short sight and long sight, it can be corrected by eyeglasses. At least it will be helpful, the eyeglass. They might not be able to see 100% well, but they can serve themselves. Hearing also, either bilateral hearing loss, it need to test or referral for hearing aids or other intervention. So they might need hearing aids to help them. Also, we need to, when we are talking, some of them, they didn't prefer to wear the hearing aids. So in this case, we have to manage to talk with them, to stand in front of them while we are talking with them. They can read at least our lips. Nutritional and sleep also. Malnutrition, it might be expected because of many things, either because of lack of appetite, they are not eating well, or because of malabsorption. Use of nutritional risk assessment from American Dietetic Association, it can be used to identify the nutritional problems and impairment for those old age. Sometimes it is something that you can laugh with it. So we need to, the old age people to say sometimes that with the age come skills is called multitask. So they can do multitask at the same time. So they can laugh and cough at the same time, sneeze also, and sometimes weep or pass gases at the same time. So it is a multifunction. This is a caricature, this old woman, she is saying that. So she is considering it as a multifunction at the same time. They can do many things, but we have to consider also the wisdom of the old age, not to consider only those changes, and the presence of an old man in a family. Yes, he might need a care, but it is a false support for us also. It is a good support for us if we are considering it, and if we are taking from their own experience. They are having a long experience in their life. Yes, there is a lot of changes, but still we are in need for their support. We are in need for their wisdom. So there's no need for it. This is from the statistic. Here it shows the age of the population for male and female. This is in 2005. So in 2005, you see that the age from 0 to 5 is very wide. It means that fertility is more, means that the population is younger. See here, those who are less than 24 years old, they're very wide in the base of the pyramid, in both sides, in male and female. Here it shows also that females are less than males also. Those who are in age of 80, they are a small community. So this pyramid, it will us in the planning and to see what we can do for those people. So those who are in over the age of 65 years old, almost men also are more than women here, more than 80 women and men are similar. Here they expected in 2050. So they expect that those who are older than 65, the number of them will increase. This expectation, it might be due to the health care provided to them, lifestyle change also, it might be better. So this is the expectation for 2050. So they have to plan also for their care, because they expect that the community or more community will be there. Here, see also, it is almost the same number up to the age of 30 for those groups. It means that also here the fertility were more, or here it means that the number of small kids are less in consideration with other age group. So this is the demographic data changes that might be expected. What's aging? We mentioned that at the first slide of the beginning of the session, that it is the sum of all the changes that normally occur in a person with the passage of time, that start at conception and end with death. Again, this is the same terminology. The normal changes in elderly, we said that also there are a change with sensory system, with a sight, with a touch, with a hearing, with a taste, with a smell. All the 5 senses will be changed. They will be start to deteriorate, to be less sensitive to that. In the touch, sometimes there is another thing, that pain will be there even sometimes. Tenderness will be there even with touch. With diabetic patients, that there will be also numbness will be there sometimes due to changes in the peripheral nerve ending. So they will feel numbness sometimes. It needs care, it needs some vitamins to help the nervous system or the melanin sheet to be in contact. Muscular skeletal system, cardiovascular system, all of this there will be changed. In the muscles, the muscle bulk also, it will be changed, it will be less. The cardiovascular system and respiratory system, also the ability of it will came down. Gastrointestinal system also, and genitourinary also, they will be affected. Genitourinary for male, it is expected to have senile enlarged prostate also. Neurological system also decrease in sensation level. Mental changes also will be there. It depends upon the person ability. It will depend upon if he is having secondary illness or not, secondary agent or not. There will be also emotional changes. In general, also, those changes, it will be affected by many things. One of them, which is the lifestyle. As we mentioned before in the beginning of the session, if we are active, more active, we can maintain our body system for a maintain in a good condition for a longer period of time. So it depends upon our activity. If we are active, taking care of our health, taking good nutrition, in this case, the possibility of having good function of our body system, it will be for a longer period of time. But if we are lazy, if we are activity is low, diseases will start early. We may become obese, hypertensive, diabetes, and the complication will start early. And we look older early. Are you agree with me?
Yes.
So, life experience also, life's experience. By life experience, we might avoid those things. Some people, they are taking the risk regardless. They know what the thing that they are doing it badly in their health. They know the consequence of it, but unfortunately, they are not following. So we have to more concentrate on that. Personality traits also, which is taking risks sometimes. Physical health. Also, if we are free from diseases, it will help us. Social support. When we find a social support, when we find someone to take care of us, also this might prevent the sequence of psychological problems and mental problems. So, the type of aging, we mentioned that the primary aging and secondary aging. What's the difference between primary and secondary? Primary heredity, secondary because of illness mostly. So, biological process, rooted with heredity here, defect in disability from the hostile and factor that environmental and trauma and disease. Life expectancy, the average observed year of life of a species from birth to death. Life expectancy for children from birth today is 77.2 years. 85 years, life expectancy is 6.3 more years. Lifespan, which is the maximum potential for survival, particular species, a human being exists, can be from 115. This is the mu'ammirin, they can reach up to 120. We heard also about, and so some of them, their age was, his age was 125 years old. And he was still in a good condition. I mean, his mental health, yes, he is debilitated, but he was able to walk, to serve himself, and also mentally he was good. Also elderly, and we mentioned that gynecological nurses, which is gynecology, is the study of old age and to care of old age. Gynecology, it means the studying of old age problems. The gynecological nurses, which is the science considered with the disease of old age. So the nurses who are studying how to deal with the old age problem. So it is a specialty, one of the specialty of the nurses. So the nurse is taking care of all ages. Elderly, we said that it's more than 65. The major health concern of aging population, older in the community. We have older in the family and older in the individual. In the community itself, if we refer back to the 2050, if you see that the community is having a large population who are aged more than 65 years old. It means that they have to provide services for those people, and they have to plan services for their people, for their health, mental health, physical health, for also the care and providing maybe hospice or some society to take care of them and to deal with those conditions. So it will be a community, it might be burden or that the community have to plan for it. And older in a family also, he needs some special care, he needs some special procedure, he needs some special equipment, he needs someone to take care of him sometime. So they have to divide the work and to manage with caring of an old man, especially if that old man is debilitated and he cannot serve himself. So if any of our family is having an old man who is unable to serve himself, in this case, they have to have a plan for that. It will change their life, isn't it? So they cannot go out without keeping someone with him. Sometimes they cannot accompany him outside. It depends upon his level of and ability. Elder individual, this is the individual problem himself. How he will feel about himself when he is unable to do something, when he is in need for help. So all of that, it will create problems for the individual himself. It will create some thing that we have to overcome within the family, within the community. So sometimes younger people have negative belief about older people. For example, older may be viewed as too old for surgical procedure, even though they must tolerate the surgery. And sometimes when you are going to the hospital with a grandfather who is 80 years old, and he is having some problem which needs surgical operation, they will think a lot. They will do many investigations to see what we can do for this man. He is already 80 years old. And they consider in mind that in this age, it is the last few days in his life. And so sometimes what they think that they didn't want to take the risk of operation and then to be asked, is it the operation which caused the death for that person, or is it the disease? So there is some dilemma that will put the caregiver sometime in dilemma of this care. But whatever his condition is, if he can tolerate the operation, unless if there is some condition that prevent that the client cannot tolerate either the anesthesia, or even the anesthesia now they can do spinal anesthesia if they cannot tolerate general anesthesia, unless there is condition also that prevents the anesthetist from doing that. So it has to be done regardless to his age. It doesn't mean that if he is 80 years old, we should not do the care, needed care for him, or surgery. The nursing roles here in community nurse roles, community health nurse help the family to maintain positive attitude toward the aging, and also assist the older to enjoy their longevity of life experience. So we have, when the person, when the older man is feeling that he is supported by the family, also this psychologically will help them, and also will keep their ability more, because if psychologically you are relaxed, also this prevent the tension, this prevent other diseases sometimes. Older within a family, so the community health nurse also help the family to maintain positive attitude toward and age-assisted older to enjoy longevity. It is the same thing. Aging families are assisted as per their structure, function, and development of other attributes. What's the changes within that family? The structure approach can be done by family genome, which include the three generation. So we can see that this is for the study of what's expected in aging process. So we have to look for the three genomes الجد الثالث نشوف شو what's the changes that happened within them, in order to get some expectation and what we can plan. The nurse can also use this genome to know more about the family member. Because of that, when they are taking history also, in general, when we take a history for any person, we ask for their family, if there is some illnesses within the family, father, mother, grandfather, in order to help us to see if there is a familial tendency for certain diseases or not. This is the family genome and how we can see if there is any possibility of other diseases, if what is the main diseases that their previous generation were having. Is there any condition that we can put it under study? The functional approach also is described by activities to meet also the sexual and economic, reproductive and educational need of aging family. Also, the nurse examine the aging family functional task. This will help her to assess their involvement with their older person, so she can see what's the ability that they can do, what's the thing that they are doing with him, and what's the thing that it needs supported, what kind of thing that they are in need. The developmental also approach, which is emphasize the synchronization of several dimensions like individual time, family time also, and historical times for that family. About the family caregiver, one slide is remaining. So I think instead of giving a break and coming back, we will continue. It will not take too much time. So we will continue with the session because I will have the 2 sessions. So instead of giving you a break and coming back, we will continue it. Is it better, I think? Huh? So the family caregiver also, mainly grandparents are raising their grandchildren. So mainly we are the grandparents, they are helping the grandfather in their life. Mostly female also are the caregiver, which most of them are working. So if we look as the caregiver, mostly by females within the family. They are more what we can say so they are having the more liability to give the care than males, but it doesn't mean that the males will not give. Caregiver also assist in the daily activities of living. He have to assess what kind of daily activities of living that they need to deal. Also, respite care, which is temporary relief of caregiver for the care. Sometimes, you know that if we are looking at the hospital and hospital construction, the hospital cannot admit all geriatric people for the rest of their life in the hospital. It cannot be done. It is not the work of the hospital. In this case, all the bed will be full with geriatric person, and there will be no space for other to take care. I didn't mean that we should not take care of the elderly, but the care of elderly, it is mainly with the daily activities of living. Even if they are taking medication for chronic illness, they can take it at home. The caregiver can give it. The care it can be given by the caregiver. So we can train the caregiver to do. We can support the caregiver. The support, it can be by some equipment. The support, it can be also by economical support. Or sometimes there are some institution for that, like hospice, daycare center for an old man. So community health nurse take a major role in respite of care also. We have to see also, and it is from the role of the community health nurse to see if there is abuse of the old man in the family. The abuse, it can be negligence also. So expectation of negligence is there. Abuse, either physical abuse, they are obliging them to do some thing for the family. Sometimes slapping them, pushing them, preventing them from going out, restraining them, molesting. So all those kind of activity that done against them, psychological, threatening and mediation, threatening them if you are going out, we'll do so and so, we'll prevent you from doing something. Exploitation or misappropriation of funds, of properties. Sometimes they are taking their properties. This man now, he is unable to deal with his money, to deal with his trades, to deal. So it can be sometimes taken from them, and sometimes even if they are able to do that, there are some of the people, not all, some cases are there that might go to the court and say that this man is unable to manage his money. He can give it to someone who are not in need for it, and we are more in need for that. So, and we are more the eligible one to take it, so they might take his properties. تحكموا بحسابه بالبنك، في الأراضي اللي عنده، البيوت اللي قبل ما وقبل وفاته. Medical also, medically, they might hold necessary drugs or medication that he is using. He might not giving them the drug on time. It might be that they think that they will take it by themselves, and it might be insisted. They know that, and they want them to die early by preventing them from taking the medication. Might happen sometime. Negligence, either passive or active. Sometimes it might be self-negligence. In case of depression, that why to go to the hospital? Yes, I feel that I am in need for treatment. I feel that there is a need for surgery, but in this age, why to do that surgery? Especially if it is costly. Why to spend this money on myself? Why not to save it for my children, my nephews? So sometimes negligence, might come from the old man himself. He is neglecting himself. He is feeling that no need for spending, especially those money on himself. It can be spent on those younger, rather than I am today or after 1 year or 2 years I will die. So why to spend those money on myself? It might be coming from the family members, this feeling. The nurse role in prevention of the abuse is primary prevention goals and secondary prevention goals should be there. The primary the prevention goal, which is support the caregiver. So when we are supporting the caregiver and preventing potential for abuse, yes, sometimes the caregiver, especially if sometimes it will be burdened on one member of the family, the other are not taking care. It might be in one of his son or his daughter, or her daughter or her son. There might be 10 daughters or 10. One is taking care and the other, they are washing their hand from that. So we have to support that man. Secondary prevention, early case finding of abusive situation and crisis intervention, referral, follow-up of elderly family and caregiver. In demography of elderly, as we said, as we see in the demographic study and expectation, we see that the aging population is growing significantly. It is difficult for them to access health care system, and sometimes they are alone. Mostly elderly population live in rural area. It is not always, but mostly they are living in rural area. They are away from the care. They are away from the health services. So they have more chronic illnesses combined to generation problem with access to transportation also, and inadequate health care facilities at that area. So we have to take care of that. When they are sick, also family member sometimes refuse to give up, whereas the elderly people believe the only cure for old is the death. So sometimes this is the belief of them. So regardless, yes, all of us, we are going to die. We don't know if we are going to die as after 80 or after 60 or after 40 or instant. We don't know. We don't know. We cannot expect that we expect that we will live up to tomorrow. But regardless of that, we have to take care of ourselves. يعني اعمل لآخرتك كأنك تموت غدا، واعمل لدنياك كأنك تعيش أبدا. وهذا برضه بيعتمد عن بيرجع على صحتك مش بس So it is also to the side of health. Healthy people 2010 objective for older adults. طبعا we have also to avoid to see if they are, because this is in Western country mostly, they might use substance abuse because they are lacking of family support sometimes. They are because of that they are going to substance abuse. Also environmental quality, they might live in a very low community sometimes. They are living on the street. Access to health services also to be provided for all. So physical activity also, obesity, overweight, that are problem, tobacco use, mental health assessment, injury and violence toward them, immunization, all of those things we have to take care of it. Older as individual, the goal is to maximize their independence. So our goal is always to maximize their ability to serve themselves. By doing that also, it will keep them active, more active. Yes, we have to show them that we are willing to do the care for them. But the thing that they are able to do, they have to do it by themselves. It is not because we didn't want to do it for them. No, but it is because we want them to be active. This will help them to be more healthy for a long period of time. Focus in promotion of health and primarily the prevention to maintain autonomy for them. Functional ability also depends on individual characteristic and setting environment. We have to help them to cope by assessment and facilitating the changes. And they may exhibit multiple health problems with complex interaction required disciplinary collaboration of care. So they need a collaboration of care from the caregiver, from the family, from the community health, from the hospital, from the community support. All of those they have to share with that. Chronic illness, 55% of elderly have at least one chronic illness. So they found that 58% of those older people, they are having at least one chronic illness. 30% of them, they are having 3 conditions or more: diabetes, hypertension, renal failure. 20% of them depend on at least of someone to help them in their activities of living, of daily living. So around 20% of the old people, they need some extent of care, direct care. The common problem of them are hypertension, atherosclerosis, dementia. Dementia also, it is even if they're physically good, but the impact of it on the family, it is too much. Because if they are going out, they cannot come back to home. They have to have an eye on them wherever they go. The problem are mostly because of unhealthy lifestyle, choice like smoking, obesity, also sedentary life, or poor adaptation to stress. Nowadays, you know that there is increase in the percentage of people who are having hypertension and diabetes. It is mostly due to lifestyle, sedentary life, overeating. We are eating more than the requirement, which is needed for us. The activity that we are doing is less. We have to enhance everyone to do more activity and to take food according to the body need. Causes of morbidity and mortality, which you can refer to the table in page 867. And the question that you have to consider: what's the most common morbid condition in an elderly? It might be cancer, it might be a cardiac condition, renal failure. What is the common cause of morbidity in elderly that will cause them debilitated and dependent? What are the risk factors for their illness also? So you have to find out and to see what's the answer of those questions. In assessment of older people, we have to physically assess the area, most affecting function, vision, hearing, and strength, as it's mentioned before. The functional assessment of individual ability for self-care, doing activities of living. Mentally assessment focus on mood and memory. And also socio-environmental assess the family living situation, support system, if it is available or not, and what kind of support system is there in the community, how they can help. Financial status of the family, do they need financial support or not? Environmental hazard within the family, within the home, and sometimes we need to do some changes in the client room in order to suit him, in order to avoid physical injury. The psychosocial aging or aspect of aging, we have coping with the retirement. At the age of retirement, you'll find some yourself after being active, going to work, earning too much money, sitting at home, no work, no activities. So this also will affect those retired person psychologically and their health sometimes. So they have to think of, after retirement, what they can do. They have to think of some activities that will help them to maintain their life, to how to manage their time. Because of that, sometimes you see, if your father is taking leave for a long period of time, he's not returned. If he is not going out, he start to ask many questions, many things. Why is this thing done like this? What's happened? What's this sound? Why this child is doing this behavior? Why what's happened in the kitchen? So there are many questions sometimes which might disturb the other in doing their work. But if they are engaged in something to do, this will minimize those things. Management of relationship also with others, having some friends, having someone to sit with him, and maintaining self-esteem, and coping with loss and grief. Some also, those who are reaching 80s, they find that most of those who are in their age, they are already lost. Sometimes even within the family, is the wife, she's losing her husband, or sometimes the children, the oldest child may die before her, so he is feeling grief for that. Why? Sometimes he is asking, why my son died while I am still alive? So we have to support them also psychologically. We have to refer back also to our religion, and we have to accept whatever what's the thing which has happened. Abuse also of elderly, as we mentioned before. So to prevent healthcare issues for elderly, we have to assist sensory integrity. We have to take care of sleep and nutrition. They have to sleep well. Mostly old people, they are not sleeping well. They are waking up early, or sometimes they are having difficulty to initiate sleep. Elimination also, they might have constipation due to lack of mobility, urinary tract infection, mobility and communication also, their ability to communicate with others. Cognition might be affected also. Employment and retirement, they might be retired or unemployed. Thermal regulation, the ability to regulate their body temperature. You know that the subcutaneous tissues, the subcutaneous fat might be lost, and they will feel cold easily. Comfort and spirituality also, we have to take care of that. That will help us in many aspects for the spiritual care. If they are referring to the mostly going to the mosque, able to go to the mosque, pray, read the Holy Quran, this will help in all of those things. It prevents psychological and problems. خلصنا. Special health care consideration of elderly people, as we said, immunization, medication, chemical addiction, we mentioned it before, ethical dilemmas sometimes that might be there. For immunization and medication, we mentioned that also before. So most of the old people, I remember sometime when I visit some of my old relatives, because they know that we are nurses and we know about the medication, the first thing that they will ask us about, they brought that big bag of medication and let us, we're asking about that medication. Sometimes it might be, some of that medication might be expired, some of it might be the same medication but different name. So we have to see sometime what kind of medication that they are taking. Are they taking it regularly? Why this medication is stock is there with them? So those problems we have to. Addiction and abuse cirrhosis also some which increase the level of anxiety on vitamin. So the comprehensive elderly assessment, as we said, also we have to take a full history for them, medical examination, which has to be regular, as and we mentioned, it has to be regularly and annually. Diagnostic test schedule according to their age, and investigation for that. Diagnostic test schedule, group, social condition, nutrition and hygiene, also socio-economic environmental assessment, it has to be done. Risk for bed sore for those who are unable to debilitated patient, mini nutritional assessment, and incontinence screening. Group 2, modified mini mental assessment examination, geriatric and depression scale, memory counting test also. Group 3, which is the mobility activity of daily living, instrumental activities of daily living also, time going up and test also of the time. Their balance and gait, are they are they able to walk, are they able to maintain their balance? So all of this we have to maintain. So this is the last thing, which is the objective for services provided for elderly, to enhance the elderly health care services in primary health care of elder people, to enhance primary health care institution to help the elderly also, and increase the community awareness about the importance of elderly care services and ensure the participation. So this is there any question related to the elderly and what thing that we have to do to care for them? Any question? So as a community health nurse, you might go to some of the families, you might visit some family that they are having an elderly people, so you have to see this assessment. Sometimes I told you, the cases of dementia, it needs a special care sometime, and sometime whenever someone is coming to them, even if they are just left the meal, after he finished his meal, he might say sometime for the people, they did not provide me with food, they are neglecting me, they are not taking care of me. So don't depend only on that. See how he is, his condition. See his cleanliness. See the cleanliness of the room also. All of those conditions should be observed. Yes, for dementia, it's expected from them to hear those things. So even though sometimes, in the other hand, some of the people who are having the intact in their mind, they might be neglected, but they will never say that they are neglected to others. We have to find out from also the assessment of the environment of that old man, how he is living, what's the furniture which is there, what the cleanliness around him, the cleanliness of his clothes. By that we can see, are they neglected or not? Are you with me? So this is from the assessment that we have to do. Okay? Thank you.